This is Jordan. I'm the Orthopedic Program Manager and Nurse Practitioner on the Orthopedic Unit at Providence St. John's Health Center. This video is designed to go over discharge planning and help patients to formulate a plan for their recovery following their surgery. Discharge planning is the disposition when you are released from the hospital. It's important to have an idea where you'll be recovering and who's going to be there to help you. The average length of stay for a total hip or a total knee replacement is about 1 night in the hospital, so it's ideal that you prepare for discharge home on that day. Make sure that the person is available to pick you up who will be taking you home. Assess your home environment so that any safety issues or obstacles can be addressed by physical therapy or the hospital staff prior to your discharge. The options for discharging include home with self-care, home with home health, which includes nursing and PT, and skilled nursing facilities. The person responsible for assisting patients with discharge planning is the case manager. They help to assess, plan, facilitate, and coordinate arrangements for a patient's discharge. Our goal is always to have a seamless transition of care so that you can have the most optimal recovery possible. When you're here in the hospital, they'll come to see you and discuss the options, and they'll make any arrangements necessary for your discharge. Approximately 20 to 30% of our patients are discharged home with self-care. This means that there are no services that will be provided at home, such as nursing or physical therapy. Those that go home on their own are typically on the younger side, in good shape, and otherwise healthy. These patients must be motivated on their own to perform the exercises that are provided by the physical therapist here at the hospital, and you must be able to get up and walk several times each day. These patients should also be comfortable managing their own medications and doing basic functional activities independently, such as getting in and out of bed and up and down from the toilet. The majority of our patients, roughly 65 to 75%, are discharged home with home health. This usually means that the patient will be visited at home by both a home health nurse and a physical therapist. The patients that require home health are typically those that feel they are unable to complete the home exercises independently or feel they might benefit from some ongoing support. So the home health nurse typically assesses surgical site, will review your medications with you, and provides other support as it's needed. The PT that is done at home is very similar to what's done at the hospital. Things such as bed exercises and gait training will be done. We don't do anything too intense at home. We want you to be able to heal, and you can do that stuff after 3 weeks when you go to outpatient physical therapy. If there are any issues that the home health agency comes across during a home visit, they'll communicate it to the surgeon's office so that it can be addressed in a timely fashion. Most insurances will cover home health to some degree, so it's important that your case manager will be seeing you in the hospital. They'll make the home health arrangements. They'll go through your insurance and ensure that these services are covered prior to discharge from the hospital. Only 5 to 10% of patients that underwent total hip or total knee replacements discharged from St. John's to a skilled nursing facility. In the past, the number of patients that would go to a rehab facility was much higher. However, new techniques and advances in medicine have greatly reduced this number. The skilled nursing facilities provide increased physical therapy to continue working with patients so that they can safely be independent at home. Physical therapy here in the hospital will help to assess patients and determine whether or not they would benefit from a skilled nursing facility. If it is determined that it is necessary for you to go to one of these facilities before going home, the case manager is the one who will work with you to find a local rehab center where a member of our medical team rounds on the patients. They'll also go through your insurance to ensure that this service is covered. It's still fairly common also for hip fracture patients with surgical repair to go to a rehab facility, but even with this, new techniques have made the recovery much easier and faster. Our goal for all patients, if they do go to a skilled nursing facility, is to stay no more than 7 to 10 days. That's it for this discharge video. I hope that you were able to take away that you should be thinking about your discharge planning now. You should have an idea of where you're going, who's going to be there with you, so on and so forth. The 3 different options are home with self-care, home with home health, and or a skilled nursing facility. If you have any burning questions, please give me a call. My number is 310-829-8079. Again, I'm Jordan, the Orthopedic Program Manager here at St. John's Health Center. I look forward to seeing everybody soon.